There are about less than 24 cases here in the United States. But if, as many project, including Dr. Scott Gottlieb, the former head of the FDA, we have a blossoming of cases in the United States, will the fear exceed the reality of the illness and cause people to cancel travel bookings?
I think we can count on humans to be good at fear and not so good at reality. So, you know what? The reality is the flu is a dangerous epidemic every year, but there's not a lot of fear for it. The cancellation of the Mobile Congress in Barcelona, there's no coronavirus in Barcelona. They're just worried that maybe it's going to show up there. So travel is voluntary, and anytime people do something voluntary, they don't do it when they're afraid. So I think not only do you have the impact of a lack of Chinese going outside, because the Chinese tourists and Chinese travelers are a big part of the global travel market, you've got a lot of people afraid to go places. And as this virus expands in its normal outbreak course, you're going to have a lot more fear, I think, than reality in most areas of the world.
And you have a traveling public. I speak for myself here. I know I speak for you. At this time of year, getting on an airplane that is crowded with a lot of people, there are a lot of, I don't call them pathogens, but viruses circulating there. I don't love it to begin with.
Look, viruses are so small, they're unimaginable. You could fit 100 million coronavirus on the head of a pin.
Wow.
So these are 120 nanometers wide. So, you know, bacteria and viruses, these things people don't really deal well with. And ultimately, you know, the government and others are working hard to say, hey, look, if this happens and we have 500 or 1,000 or 2,000 cases, let's deal with it reasonably and smart. You know, but if you go to Seoul, South Korea, which has 28 cases in the whole of the country, the restaurants are all empty in South Korea. They're just empty. Fear is a powerful thing.
Fear.
You know, you're not going to send your kids to school if there's a 1 in 200 chance that they may get sick or become a carrier and kill an elderly person. So this is a big challenge for the government. And Secretary Azar and Kadlik, you know, Dr. Kadlik, who's the Assistant Secretary for Preparedness and Response, those guys get it, right? They understand we need to be transparent with the American people. We need to tell the truth at all times. We need to be sort of the opposite of what's happened so far. And we need to trust people to understand, hey, we're going to do some things differently. We're going to adapt. This is not Ebola. We can deal with this.
Well, it's interesting for people who aren't aware. You have a ton of other companies, Priceline just being one of dozens that you've founded. You have dozens of patents as well. And one of them is for something that you brought with us today. You've done work on pandemics, and you think there's innovation here that can kind of help when it comes to quelling the spread of these outbreaks.
Well, the U.S. government is looking outside the box here for new solutions, and I and a team have been working for the last several years on just such a thing. You know, it's one thing to say, wow, I can create a drug, but it's another thing to figure out how to put it in a glass vial and get a syringe.
For something like a vaccine, for instance, against something like coronavirus.
Yeah, so ultimately, you're going to need something like this. So this is how your eye drops come, right? This is made in just seconds and filled aseptically. We have invented a way to fill a vaccine and have the needle all in one, high-speed, super low cost at population scale. And we've been talking to the U.S. government and others globally about how this could make a giant difference in vaccinating people safely all around the world, because vaccinations or shots, reused needles kill over 1 million people a year.
And that's absolutely legitimate and then a separate issue. In this case, for coronavirus specifically, the best, I guess, scientific estimate right now is it could take 6 months to a year to come up with a
It's
vaccine.
going to take us time, though we may have therapies sooner, and if we have effective therapies, maybe we can go much faster to get those out.
This device, which is a medical device, is it pending in front of the federal government? You've got to get approval on it, right?
Well, in an emergency, the federal government can move quite fast, and this government really understands that an epidemic is about speed and volume. It's about moving quickly and having enough people in enough places. These people have done an excellent job in reaching out to us and saying, wow, this technology wasn't scheduled for a couple of years. What could we do to accelerate it forward?
The fast track idea
really
on drugs
fast
and other
track.
things.
Yeah.
So you said something, well, we were on break, and I hope you don't mind that I use it
You're
here.
going to get me in trouble.
And that is the idea that you've been working on pandemic preparedness, and you think as a business, it could be bigger even than Priceline. That says a lot.
Well, you have to understand, pandemics have been around since the dawn of mankind. And it only takes a pandemic like this in China, where the actual number of cases is enormous, to wake us up and go, what do you mean we could have 50 million cases in China or whatever? So ultimately, the size of a business is about the size of the customer base. Every human is a customer for a fast-acting device that helps them save themselves and their families. Priceline's a great business, but every human on the planet is not.
It's not using Priceline. No.
Today.
Jay Walker.